In the news this week, can the COVID jab insurance increase public confidence against negative impacts? A WAMA News exclusive.
Also another scoop, Yangebup residents produced a video to spread the word as they fight against an industrial crusher plan.
Mask off and out of lockdown, WA returns to normal as venues and indoor sports celebrates.
And on Western Perspective, a feature interview with opposition leader Mia Davies, plus Dr. Andrew Miller's weekly comment.
This is the Evening News with Ivan Learn and Sarah Smith.
Good evening and welcome to the program. We start tonight with a different issue that is lurking in our minds from time to time. As we're preparing ourselves to roll out for Western Australia and fight the virus, some people are holding back over concerns about a small number of adverse reactions to the vaccine. Now, insurance usually covers the cost of the jab, but not the negative impacts if unluckily things go wrong. And when it comes to the issue of liability, the National Disability Insurance Scheme won't compensate for temporary injuries caused by the jab. Now, according to an article from the University of Sydney, people who suffered side effects wish to be compensated will have to pursue it via the legal system, which is expensive and complex. They will also have to pay for their own medical treatment via Medicare or private health insurance. So will an insurance cover the minor risk help to eliminate doubts and encourage Western Australians to take the jab, safeguard the community and fight the virus? The Australian Medical Association President Dr. Andrew Miller joined me earlier for this exclusive. Dr. Miller, thanks for your time. The health insurance in Australia seems to only cover the costs of vaccine, but not the possible risks. Will it help public confidence if negative impacts are insured?
Yes, we want the government to match the indemnity that they have given for the vaccine manufacturers and provide some support to GPs who are taking on the risk of providing particularly the consent process around the AstraZeneca vaccine, which, as we have seen, is a little complicated with some of those clotting complications that are occurring with it.
Currently, the only way to seek compensation is through costly legal and civil means if things do go wrong. Is that a concern to you?
It's a valid concern that the patients will need to sue if they feel that they have had some damage from a vaccine. It would be ideal if our country had a no-fault vaccine damage compensation scheme. That's unlikely to happen anytime soon. So in the meantime, we need the government to step forward and say that they will take on the liability so that people can approach the government directly. This is a community-wide service that is being provided, and the people who are given the vaccines should be looked after by the community through the government.
Now, as the expert in the medical field, what should be done to rectify the problem so we can increase public confidence to roll for WA? Because at the end of the day, it's all about trust.
The government and the medical indemnity insurers, the ones that insure doctors for being sued, should be working together to come up with a solution to provide patients with full confidence that they will be looked after should there be one of the very rare problems that could occur, and for the medical profession just to get on with doing what they do best, which is getting as much vaccine into patients as they can.
So what should the government do about this, in your opinion? What's the way forward to boost safety confidence?
Yes, trust is very fragile around vaccine, which is why it's very important that this whole process be very open, very clear. We be talking about any problems, particularly with this clotting issue around AstraZeneca, so people fully understand it and also understand the risks of trying to find a vaccine in the midst of a potential future outbreak, which would also be very difficult. So hopefully we'll have more vaccine choice later on in the year, but we would like to see the government working very closely with the profession and being very open with people about all of the data around vaccines and any associated problems.
And you can see Dr. Andrew Miller's exclusive weekly commentary segment late in this broadcast. Dr. Miller, thanks for joining us tonight.
That's my pleasure. Thank you for having me.
After 6 weeks of intense anxiety about the fate of their community, Yangebup locals are relieved to learn officials do not recommend a crushing facility to be built in their suburb.
While the council is still to vote on the site's approval, it's a huge win for the safety of their families. Kit Sanders with this exclusive.
Hi, my name's Keith. I live in Yangebup. I'm about 500 metres away from where the crusher development is being proposed.
Liam McGovern and Keith Wood live just 500 metres from the site where the crusher would be built, despite the EPA recommending these facilities not be less than a kilometre from residences. The couple worry about the health of their young son and community from toxic particles the facility may produce.
We're already copying the dust from the Coburn cement factory, and that's 3 kilometres away.
With the discussion of the Brakovich application, the thing that I just keep coming back to is who will ultimately be responsible when thousands of residents get sick, because we will inevitably get sick if we're inhaling dust and silica particles all day, 6 days a week.
I have a lung condition, and it makes me very afraid that they're going to have that crusher put in there.
We moved to Yangebup 8 or 9 years ago to raise our family, and as you can see we have 2 small babies, and obviously the main concern for us is the health of our children.
We didn't get any contact directly initially from the council about it, and we heard about the plans or the proposal for the crushing facility through our neighbours only recently.
Leah says she is very proud of her community for how hard they have fought and the hundreds of submissions they have contributed to the council.
I kind of didn't have that much faith in the process, but this has given me some faith. The professionals did the right thing with a few thousand, 100 submissions.
The council is set to make their votes next week, and Keith says that even if the outcome is not in their favour, they will keep fighting. Keith is relieved that he and his son will not have to worry about the air that they breathe while playing outside.
It's been a bit of a roller coaster of a ride these last weeks or months, and now I hear that the expert advice coming back or to be presented to the councillors is that the crusher be rejected, the proposal. So I'm feeling quite elated.
Kit Sanders, WA, MN News.
Meanwhile, the City of Coburn's Acting Chief of Build and Natural Environment, Daniel Arndt, has responded in a statement. The City has completed its assessment of the proposal, and the matter will be considered at City of Coburn's Ordinary Council meeting on Thursday, 13th of May. The report in the agenda assesses the proposal under the City's planning framework, with advice provided by the Department of Water and Environment Regulation in relation to state government air quality requirements, taking into consideration all submissions received during the 35-day public advertised period and information provided to the city by Brakovich Landfill and Recycling. And you can read the full story on our website.
Bibra Lakes indoor futsal players are excited to be back at their pitch this weekend, with COVID-19 restrictions easing in the Perth and Peel regions. The McGowan government this week relaxed mask wearing and venue attendance rules after consecutive days of 0 cases. Nelson Liu reports.
Partygoers queuing outside Perth night spots, signs of the city returning to normality after a COVID-19 lockdown and restrictions, with businesses back in action and people out without masks.
I think that's great news. It's very much welcomed.
El Abraham's indoor futsal business has been hit by the lockdown and restrictions, but now his ecstatic kids are back on his pitch this weekend.
I don't think there's anything we can do to stop them going on.
Players and spectators have returned to the venue in Bibra Lake after staying away because of uncertainty and safety. The lockdown and restrictions have made it hard for El to grow his business with our players.
Not having, being able to do that, it's taken a massive toll on the business.
But the excitement is now back and in full swing.
They're going to come flying through those doors. They're going to be balls flying all over the place.
These restrictions began on Saturday for 1 week, after 5 days of consecutive 0 new local cases. Under the changes, masks are no longer mandatory indoors or outdoors, but will be needed on public transport, at events or venues with over 1,000 people, hospitals, aged care centres and gyms. Nightclubs can reopen, sports stadium capacity will return to 75%, and people will also be able to welcome up to 100 visitors in their homes.
People have followed the health advice that is there to protect us. We must continue to follow this advice and our healthy habits so we can return to pre-lockdown life.
But for El, he's just happy players are back on the pitch once again.
The biggest thing for us is seeing those smiling faces and people, happy to be on the pitch again.
Nelson Liu, WAMN News.
Des Hopper Tier 3 rail line will be included in the federal government's infrastructure budget as development continues for a business case for the project. The Rail, Tram and Bus Union WA is pushing for a good business case for the project, but hopes for adequate funding to produce the rail line that's expected to create jobs. Secretary Craig McKinley says a good business case is key, but there's no point if there is inadequate funding.
Tier 3 is incorporated within that application, so effectively a pot of gold, we hope, will come from Canberra, and then it will be divided accordingly. And for us, Tier 3 accordingly really gets down to the business case. So a business case has been happening for some months now, well since last year, and how much money we get and where it goes and how it goes will really depend on the business case.
The WA opposition has hit out at maternity ward rules it says are putting new mothers at risk of trauma. The restrictions currently limit birthing mothers to one birthing support person and one visitor per day. Doula Jessie McGarry says the isolation during birth is leaving 1 in 3 new mothers with birth trauma.
We've been inundated with emails of women telling their stories of the distress, the emotion, the anxiety, the depression that they have experienced because they are going into hospitals with their husbands and partners turned away at the door.
Deputy Leader of the Liberal Party, Libby Madam, called on the government to roll back the restrictions.
The opposition have heard from a number of parents or would-be parents, as well as midwives and doulas from across the state, who are very concerned about the mental health impacts of the current restrictions.
New students will be welcomed to a Piara Waters Secondary School when it opens its doors for the first time at the start of the 2023 school year. Stage 1 of works have begun into the school, with new features including an education support centre, library, food and technology areas. The school is expected to support new schools in the area, and the state government says the school will bring education closer to families.
In fact, we have opened 2 new primary schools in the last 2 years, and there are another 2 new primary schools planned to open in the next 2 years, in addition to the new secondary school, to provide the very best education facilities for the local community.
A massive drug bust in a Rio de Janeiro favela has left at least 24 suspects and 1 policeman dead. Reports say the neighbourhood is a base for the Red Command, Rio's biggest drug gang. Police say the investigation began after reports that the gang was recruiting children. Japanese officials are considering extending lockdowns in some of the country's largest cities, prompting fears for the future of the July Tokyo Olympics. Under the state of emergency in Tokyo and other urban areas, restaurants, bars and karaoke parlours are closed. The governor of Osaka Prefecture has been reported saying an extension of 3 weeks to a month may be necessary.
Animal lovers can get fit and raise money for neglected poachers this May through the RSPCA's Million Paws Walk. This year's walk is a virtual event in WA with pet owners encouraged to get out and log their steps on RSPCA's Pawsdometer. The charity's Executive Manager of Fundraising and Programs, Ken Doran, said the RSPCA's resources are overstretched and asked people to get involved in their biggest fundraising event of the year. Registration is free online at millionpawswalk.com.au/register.
And that's our weekly news and current affairs. We have the latest news on our website, wamnews.com.au.
From Sarah and myself, we wish you good health, good night, see you next Sunday.
Thanks for watching.